Shane from Luma Health, and I'm going to demo a new service we're offering called Connecting to Care. This service allows patients to find the appropriate referral doctor, pharmacy for prescription, or an imaging center to get some diagnostic imaging done once their appointment is completed. So Luma Health integrates with your existing scheduling system, whether your scheduling data lives in a EMR or a practice management solution. We're able to detect when the patient's completed their appointment. Once the patient completes their appointment, the patient is sent a message saying that we can help connect you to the care you need. So let me show you how this works. So in my text message here, you can see that I've received a notification that says you have a new secure message from your care team. Please click here to read and reply. So I'll go ahead and click, and this will take me to a web browser. And what this link does is it takes you to our secure chat. The link is unique to the patient. And then in order to authenticate, you got to provide your first name, last name, and date of birth. Now, for the sake of the demo, I've gone ahead and already authenticated. And so you see here, once I log in, the service or the chatbot is asking me, how can I help? So I saw my primary care doctor, and he gave me a new prescription. So I'll go ahead and ask my bot if he can help me with this prescription. So I send a message, and then it says here, can I help you find a convenient pharmacy to fill your prescription? So I say yes. And I'm doing this all from my phone, so it's convenient for patients. And then ask me what zip code am I in. So go ahead and put my zip code. And then it helps to match my prescription with whatever insurance company I have. So I'll go ahead and put in I have Blue Cross. And then lastly, it asks me for what the actual name of the prescription is. Now, a lot of patients often will forget what their name is or misspell it. And so we've kind of worked in an intelligent way for the system to understand that. So, you know, my doctor gave me some sort of prescription for a cholesterol hypolipidemia. So it was something called Lipitor or something. So I'll go ahead and purposely misspell it with Lipitor. The obvious actual name of the medication is Lipitor. And so you see here, it tells you, oh, you know what? I didn't find a name by that. I didn't find a medication by that name, but could it be one of these? And I see that the first suggestion actually is they're Lipitor. So I'll go ahead and, oh yes, you know what? Actually, it was Lipitor. So I'll go ahead and put in Lipitor. And then what it'll do is it'll go and find what the best cost is. So it says here, based on my zip code, it found a place, a pharmacy near me, that'll cost me $9.85, and it gives me the address and the phone number. Now, this is great. You know, we're able to direct the patient to where they need to go. However, this is a perfect time for us to even take that next step and connect the patient to what they need. And so what we've done is we've actually allowed the patient just to be able to type yes. So he says here, reply yes, and I will initiate a phone call. Once you type yes, what we will do in the back end is actually initiate a phone call to the patient. And then we will forward it to the pharmacy or wherever it is. Now, I'm not going to actually answer this phone call, but that's what that would look like. And then the patient can talk to the pharmacist and get their prescription filled. Now, this is one of the 3 conversation workflows we worked in. We can also help connect you to a referral doctor. And it's relatively similar. So I say I need a referral. And then it'll walk me through a similar process where it'll say, okay, can I help you find a referral doctor? So I'll say yes. And then it'll ask me my zip code. And the idea is that we're trying to match you with a perfect match for what you need. So we find a zip code, we find a doctor that's in your local zip code. And then also based on your insurance, we will make sure that it is someone that is covered under your insurance. And then the last question will be actually is the type of doctor you're looking for. So let's just say I'm looking for a cardiologist. Cardiologist here. And then what we do is we know a few things already about the patient. We know the gender of the patient and we know the age of the patient. To that, we add in what insurance company you're using and the zip code, and we'll be able to match you to a physician in your locality that matches all those demographics about the patient. So see here, it found Dr. Price James, and that's his address and that's his phone number. And then again, we have the similar process where we can type yes and they will initiate a phone call. And similar to this is what we offer for imaging. Just for the sake of the demo, I won't walk you through that, but you can ask the bot to connect you to a imaging center and I'll walk you through a similar process. Now, we've been able to build this so far, but I think there's a lot more that we can do with this and make it even more engaging. And so from the next steps, what we'd like to do is we'd like to be able to surface educational material to the patient. This is an excellent opportunity to educate the patient, because oftentimes one of the major reasons for non-compliance is that the patient actually doesn't even understand what the diagnostic or the prescription was. And so we can leverage some of our partners to surface up content that is highly relevant to the patient based on, again, their demographics, their socioeconomic status, and their gender. And finally, I think what will be even more interesting than this is to be able to detect, read the clinic notes and be able to detect a new diagnosis that patient is given, or what actually was the prescription that was given to the patient, rather than relying on the patient to provide this information. It's just another further step to help make this process a lot easier. So that way, once the appointment is done, rather than asking the patient, did you get Lipitor, we would tell them, hey, we noticed you have a Lipitor prescription, and we will now help you connect you to a pharmacy that can fill this. And with this, I thank you for watching this.